I would like to invite Dr. Sabine Kapasi, CEO and founder of Inara Consulting, to please join us here on stage. I'd like to invite Dr. VeluMani, creator, Thyrocare, director, AVM Smile, to please join us here on stage. A big warm welcome, sir. And I'd now like to invite Mr. Kumar Bagrodia, founder and CEO of NeuroLeap, to please join us here on stage. A warm welcome to all the speakers. First of all, a big thanks to the speakers to traveling all across, coming here and to sharing their knowledge. I believe that the reflection of true success is the passion people carry to share all the knowledge they carry in our heart, from stories to thought to journeys to questions to the answers we have. A big thanks to all the speakers here. So this panel is going to talk about precision, prevention, and public good, the next health revolution. I'm sure we all are looking forward to it. I'll now hand the stage to our moderator and looking forward to a very interesting session.
Good afternoon. I know it is after lunchtime, so we'll try to keep it as lively as possible. So TIE has always stood for ideas that scale, entrepreneurs that solve real-world problems, and capital that creates long-term value. Few tech sectors would tick all three. Healthcare is one of them. As you all know, medicine will advance more in the next 10 years than it did in the last 100. Yuval Noah Harari, in his book Homo Deus, says that the 20th century medicine tried to heal the sick. But the ambition of the 21st century medicine is to upgrade the healthy. And this creates a paradigm shift. So we are at the intersection of three powerful forces, which is the topic of the day: precision, prevention, and public good. And where the success is not measured by pilots, but by population scale interventions and outcomes. And to talk about this, we have a great panel today who are leaders and who represent scale, science, and population level interventions. So I'd like to give a brief about the panel. We have Dr. VeluMani, and we don't need to give any introduction. But for the sake of introduction, he founded Thyrocare, one of the most influential diagnostic companies built on affordability. And he's a legend, so welcome, Dr. VeluMani. We have Dr. Sabine Kapasi. She's a global healthcare strategist and founder of Inara Consulting, advising governments and institutions on health system transformation. We have our own Dr. Ravi Kumar Surpur. He's an IS officer, he's a doctor, and he is Secretary IT, Government of Rajasthan, driving digital transformation at scale in public systems. We have Dr. Shadab. He's a senior scientist at ADIA Labs, Abu Dhabi, working at the cutting edge of AI, data science, and health research. And we have Kumar Bagrodia. He's the founder of NeuroLeap and building technology-driven solutions at the intersection of neuroscience and health. So very interesting panel. We have great speakers. So my first question to the panel, and I'd like Dr. Surpur to start on this, is precision versus scale. So precision medicine promises individualized care, but public health depends on scale. Where do we see the real inflection point where precision becomes affordable, scalable, and relevant for the millions, and not just a unique thing for the rich? So, Dr. Surpur.
Well, I think we have taken an entire, we have completed a full circle to realize this fact. When we talk about public health, we talk about three fundamental pillars. The first pillar being promotion of health. The second pillar being prevention of disease. And the third pillar, when we talk about, that is medical intervention, like treatment that we talk about. So when we are comparing precision, especially in terms of scaling it, again, the golden rule of public health would be of great help here. See, in a classical medical school, everything starts with history taking. If people have been trained in a classical medical school, investigation, auscultation, percussion, or a battery of investigations that we talk about, they are all secondary. It all starts with history taking in terms of whether a family is particularly predisposed toward a particular condition. Are there any tendency for a person to acquire certain kind of diseases? So that is where we customize the intervention. Even diagnosis gets customized. And today when we are talking about precision, we are talking more or less about the very same thing, but in a different language. So instead of a doctor taking elaborate history, which to a large extent disappeared in recent days, a classical history taking almost would consume time. So again, when we are talking about precision, we are talking about the very same thing, that we are customizing the intervention, one size fits all. Especially when we talk about medical schools, that is not something, that is not a paradigm that holds any water. It doesn't hold any water. So now the customization of medical intervention, the customization of investigations, and the customization of even the life cycle, this is something that is needed in the current generation. And I think AI is going to help us in leaps and bounds when we start looking at this aspect through the lens of AI. Thank you.
Thank you, Dr. Surpur. So, Dr. Sabine, on this same thing, what should change first? Is it the technology cost, regulation, or business models for precision medicine to scale?
So I think what Dr. Ravi also mentioned, we really need to look at, sorry, am I audible now? Yeah. What Dr. Ravi also mentioned, precision medicine needs to have a preventive outcome. I think that's very important because we have been speaking about precision medicine and personalized care. But we first need to look at what is the preventive care outcome of it. That's most important before we design a business model. I think then having a sustainable business model which informs policy is what's going to be important, because policy never ever leads. Policy always follows. And I think Dr. Ravi, you will agree with me on that one, that policy follows market forces versus the other way around, because it always has a segment of inertia, it needs information, it needs enough business intervention, and rather it needs enough level of advocacy and proof of concept to then have a paradigm shift happening in a directional perspective. So first we need to have an outcome well defined, which defines a business model, later going towards policy shifts. And I think, of course, all of this is preceded by need and need-devised technologies. And I think because you were discussing earlier about economies of scale and how that is panning out, one thing that needs to be added is everyone. So I also had the privilege of going to med school. And one of the things we learn is that healthcare system has a prerogative of keeping people outside hospitals. Let's keep it very simple. The healthcare system is not supposed to be focused towards building the best in class hospitals, but has to be focused on keeping people outside it as much as feasible. And I think when we start with that intention and then go towards choosing the right technical solutions with the right outcomes, build right business models, and then build policies around those business models, that is the progression that will yield the best possible outcome, that has yielded the best possible outcome globally. But sir, why don't you throw some light on the discussions on economies of scale around that?
Yeah, a few words I'm going to interpret in my own way and explain. In the entire world, India is cheapest in healthcare. In entire India, I was cheapest in the segment which I was working. Many people ridiculed me. But when I went for an IPO, it got oversubscribed 75 times because it had the highest profit in any healthcare company in this country. So that means it is the business model. It is the business model, and I am known for telling punchlines. If the business model is powerful, you don't need a model to sell it. So that's how that business turned out to be most powerful one. Precision. If there is no scale, there is no precision. Because precision needs investments, automations, complete system in place. If there is no scale, there is not easy to maintain precision. Scale nahi, to kale nahi. So you need to have a business model. You should be the volume leader. If you chase the volume, the value automatically comes. So these are a few things which I practiced. And healthcare in India is still unaffordable for Indians. That's one of the reasons why today you find 80% of the hospitals don't have patients in the bed. There are only watchmen who sleep in the bed because patients have not come. And there are 20% of the hospital where there is no bed for the patient. That means there is uneven distribution, unfair pricing, optimized pricing is not happening. So these are all my few inputs there. But what is going to happen now onwards, nobody will pay for your inefficiency forever. You have to become efficient. Once you become efficient, the costs come down. And the costs come down, the consumption goes up. And every positive loop sits in place. According to me, in Indian healthcare, majority of the verticals lack efficiency, number one. Number two, Indian healthcare business model itself is wrong. Either it is trust hospitals or government hospitals. Unfortunately, trust hospitals are costlier than privately held organizations. So in my opinion, equity should flow into healthcare. Profit should be the goal. There is nothing wrong in keeping profit as the primary goal. When you keep profit as the goal, you can't do it without scale. When many have come inside, without being best, you can't be the leader. I am of that opinion. By year 2050, Indian healthcare industry will be totally different, driven by efficiencies and also supported by whatever technology you call, including AI. So healthcare in India will become even cheaper. And listen to me, India will be the leader for the globe, because nowhere in the world somebody has done 100,000 thyroid tests in the laboratory in a single day. It happened in India. That means take it number of surgeries, number of any medical procedures, India will be the global volume leader. When volume is there, expertise will be generated. And believe me, India will be the medical tourism destination by year 2050. No other country can even compete with, provided government recognizes and promotes it, and India will rule. This is my positive thinking. I wish you all a happy 2026, and I wish this medical industry a totally new journey from 2025 onwards. Thank you.
So, sir, a question in continue to what you said. So you disrupted the diagnostic space with scale and with affordability. But if you were to do it today in this age of AI, of digital health, and of social media, what would be different from what you did if you were to build ThyroCare today?
I exited in 2021, not because I have become old, because I got a prize which I never dreamt. Then after 4 years, I realized I exited too early. The VeluMani 2.0 is coming.
Great, sir.
My non-compete is getting over in September this year, and I am already pregnant. But having said that, answer to your question is, paisa nahi tha, wisdom nahi tha, vision nahi tha, चलता ही रहा, बहुत बड़ा एम्पायर बना. अभी मुझे ऐसा एक फीलिंग है, पैसा भी है, विजडम भी है, वक्त कम है. So I believe what I have done, a listed company, after journeying for 30 years, I am likely to have a twin pregnancy and have an IPO in 2030, both together in the same month. This is my dream, and this both in healthcare. And in healthcare there are, देखो ये 100 किलोग्राम की शरीर में सिर्फ 15 ग्राम में मैं फोकस किया था. थायराइड इज ओनली 15 ग्राम ग्लैंड इन 100 किलोग्राम बॉडी. उसमें $1 बिलियन बनी. इसमें $1 ट्रिलियन बैठा हुआ है. समझ गया? अपना अपना फोकस करो. हिंदुस्तान से बेहतर in medical field only there are 3 kinds of entrepreneurs. One who makes money, other who makes a lot of money, the third one makes a hell of money. So please be there. It doesn't need huge capex. You just need intelligence. 3 things are needed in healthcare to do a successful business: IT, HR, logistics, full stop. You don't need anything else. And IT, you know, it is in the peak now. Of course, HR हिंदुस्तान से ज़्यादा populated country है ही नहीं है. 150 crore population. IT is there, HR is there. Logistics अभी अभी समझ में आता है after Zepto, Blinkit. समझ गया? These 3 together will make Indian healthcare most affordable for Indians also. And if it is most affordable for Indians, globe has no other choice to get best out of us, either coming here or taking us there. This is my wish.
Great,
Thank
sir.
you.
So a question for Dr. Khan. So we are submerged and we are drowning in a lot of healthcare data, from genetics to imaging to history taking. A lot of things are becoming digital, but we are starving for actionable insights, actionable outcome. So what needs to be done to make it actionable, and what are the steps to do that?
So as an AI scientist, I often like to think of what are we solving for first, right? And that begins with partnering with the clinicians to understand what is it that we're trying to achieve. Are we solving for improving a physician's experience? Are we solving for improving a patient's experience? Are we solving for reducing the cost of care? Or are we solving for improving the outcomes of care, right? Within those constructs, you then start to figure out if the problem that you're addressing is a data problem and an AI problem or not. And if it is, only then we start thinking about how do I access the data set? How do I clean it up to make it ready for analysis? And then finally, train an AI model on it and then deploy it to validate the performance, ensure that it meets the satisfying criteria for the one of the 4 objectives that we set out at the beginning. Ensure that it's free of bias, it's safe, it's reliable, it's trustworthy, it supports clinical decision making and is not in the way, right? And once all of these criteria are met, we go ahead and deploy it. Now, you made a very good point that there is a huge influx of data in healthcare, right? Healthcare has never had a lack of data problem. It had a problem with accessing that data in the right manner. With technologies like federated access and federated learning, I think increasingly a lot of healthcare providers are opening up their data sets to researchers and to academics who are interested in doing research with that data set. And I do think that moving forward, we're going to see a lot of movement away from AI that understands a single modality of data, for example, text or images, to AI that can understand multiple modalities, right? Whether that's genomics, electronic health records, and images, to truly inform the downstream applications in the best way possible. In fact, a lot of the research that I do in my lab right now is very focused on doing just that. How do we ensure that we can correlate the genomics of an individual, which tells us a lot about their predisposition to certain diseases, with their lifestyle and environmental choices, with the data sets that we have recorded in electronic health records, to the images that we see. And to provide a concrete example of that, say you want to identify individuals at an elevated risk of chronic kidney disease. A lot of the risk modeling today is based on structured elements, which are derived from electronic health records. But we know that roughly half of the chronic kidney disease patients were previously diabetics who had an uncontrolled diabetes. So, and diabetic patients often are screened for through eye exams. Sometimes their genomic profiles are known. So why don't we start looking at electronic health records and genomes and perhaps retinal scans to see if we can extract a more predictive signal of who's at an elevated risk of CKD and then intervene to make sure that that doesn't happen.
Thank you. So one question to all the panel members. So I'll start with Mr. Bagrodia first. How will AI impact? It's a very cliched question, but I think this is the best panel to ask this. How will AI impact healthcare in the next 5 years? And what is to be done in the next 3 years to make that happen? So, and I would, because it is for all 5 of you, I would like it to be short. And
sure. Thanks. It's not a cliched question. I think it's a question that we all need to dig deep in, because already, so I'm a neuroscientist. One of the areas we work with people on is on mental health. In February 25, so it's close to a year ago, ChatGPT was already beating the best therapists across the world on empathy. So patients who were using ChatGPT for counseling and therapy were rating it higher, that they preferred to speak to ChatGPT for their mental health problems compared to a human therapist. From then, it's only gotten better. The top 3 use cases across the world for AI. Any wild guesses? What are the top 3 use cases? That what are people using ChatGPT or any other AI for? Anything?
Symptom search has to be first, or at least second.
Sorry?
On that one. Symptom search has to be a second.
Number 1 is mental health therapy. Number 2 is how to lead a better life. Number 3 is help me find purpose. So they are discarding this notion that you need somebody to get a degree in psychology or psychiatry or medical health, and then that qualifies a person for me to be able to discuss my problems with that person.
thank you. Dr. Surpur.
Well, I would say there would be optimization at 3 levels. One, we talk about resource optimization, skill set optimization, and asset optimization. When we talk about government setup, we are talking about infrastructure, we are talking about manpower, we are talking about skill sets that need to be identified, which can be customized to a population. To cite a simple example, if we look at the total paramedical staff that we have, and if we try to draw a denominator on which how many of them are in a position to do, who are in a position to put a IV cannula to a newborn, somebody who is in a position to do intubation, somebody who is in a position to do CPR, somebody who is in a position to work in a dialysis center, to the skill set mismatch in terms of the needs and requirements of the population. So that is where I see AI optimizing. Another one is assets, the kind of assets we have, whether it is medical inventories, whether it is all the resources that we own. Optimization is one thing which AI is going to have a transformative potential in a sector like government. Thank you.
Dr. Khan.
Can you repeat the question one more time, please?
So how will AI transform healthcare in the next 5 years?
Right. So, I think one of the statistics that often gets quoted is that the WHO estimates that by 2030 there's going to be a shortage of upwards of 10 million healthcare professionals in the world. We're talking about delivering precision care and preventive care, and none of it is possible without technology, and technology specifically powered by AI in a lot of cases, actually influencing how we practice health today. My money is on AI being very important in chronic care management specifically. I think cardiometabolic diseases, which are a huge driver of cost and which result in lifelong illnesses for many of billions of patients across the world, I think will be hugely transformed with the help of AI, particularly with lifestyle changes and tools like chat buddies and so on that are coming out and are increasingly available through health tracking apps to sort of coach the patients on the lifestyle changes that are necessary to achieve better health outcomes.
Thank you. Dr. VeluMani.
I can't talk about 5 years because it needs everything over a period of time, how things will change. 40 years back, I had to stand in VT railway station to take a ticket to go back to Coimbatore for Diwali. Previous night itself in the queue, number one. If I had to make a withdrawal from a bank, I needed to take 2 hours permission from my boss to go and stand in the queue and make the transaction. And in the airport or station, you can't be faster. I think completely we have changed. You can, sitting on the car itself, book your tickets there, anywhere. Transaction within microsecond, nowhere in the world this kind of financial transaction happens in a minute. And when I walk, the door opens because my face is recognized out of 8 billion population in this world. What does it mean? It took 50 years. I'm sure in 50 years things will totally be different in healthcare. It's all physics and chemistry. Our body is nothing but physics and chemistry. And all radiology is in physics, all pathology is in chemistry. So if I walk through doors, the next door will open, probably this disease. Then in another few minutes, every investigation is done while I am walking. Both side sensors are there. And finally I am on a door, within half an hour, my diagnosis is completely bad. Mind you, 20 years back, it was $10,000 for a genomic test. Today you give me $100, a complete whole exome sequencing can be done. Which means what? It may not be 20, 30, 40, but I believe in 2075, 50 years from today, the diagnosis will happen without error, without guessing, purely by AI, as much as that Digiyatra recognizes my face. But this is going to happen, no one can stop it, and it will be made by India only. This is my feeling.
Dr. Sabine.
That's a tough act to follow, you know. But before I answer your question, I would like to just put one background which we haven't done. There are two areas of a lot of development that's happening in healthcare. One is focused problem solving, which is creating a stem cell based liposomal research to create neurodegeneration or injectable bone gel, or even CAR-T based solutions for precision diseases. So that is happening, and that's happening in different segments across the world at a large scale. And second is architecture development, which is what we spoke about in terms of logistics, in terms of human resource development, in terms of tech development. And both of these are slowly converging to focus on prevention of diseases at a global scale. Correct that India is going to lead the way, possibly China also, because we have the mass of population necessary, and everything from wearable devices and sensor technology development all the way till genomic system building as well as early diagnosis of diseases. All of it is happening across these two rapidly evolving pathways. I think tech solutions, not just AI, but across the board, are going to significantly change both of these, from education and training of healthcare workers all the way till AlphaFold-like technologies, which are quickly helping us evolve protein molecules, which is going to fundamentally shift both diagnosis as well as treatment of diseases, make it far more precise. So when we look at system building and how it's going to approach the entire ecosystem, that is when we understand that health, which is the need for everyone, right? Health is one of the only things that's a universal need after finance, of course, or rather before finance, but along with it, which is something that everyone is going to need either today or tomorrow. That is evolving in a very multipolar way. And that is where I see the world going every year, and in the next 5 years or 7 years. The hope is that both health and finance as systems will converge because of a single technology layer. What the government has done with UPI in India is phenomenal, and now a lot of it is being adopted with ABHA systems and all that we speak about. So these kind of stack level development is going to converge these systems also. And eventually what we spoke about in terms of actionable health data systems, that is slowly coming into picture from there, making it more preventive, making it more predictive, and making it more quantifiable both in action as well as financial terms. So I think that is where we see a lot of aggregation happening. One of the starting points in India is with what has happened with Narayana Health and how an aggregated integrated system is developing. I think more and more such systems will come through. And I think that beginning of a journey that India has taken is very important, and we need to focus on the architecture as well as the bursts of tech evolution happening, because the architecture is as important. I've spent about 20 years in developing public health ecosystems in about 100 countries now. So one of the key learnings is that we cannot just build for the top 5%. Unfortunately, the last 10 to 15 years have been a lot of building happening for a small segment of the world. For example, nutraceutical evolution has happened, but it has happened at a cost level which is not sustainable for most of the world. As we were discussing earlier, more than 85% population lives in the global south. It lives in India, APAC, LATAM, Africa. And we really haven't built for these ecosystems. So the architecture that we need to build and the solutions that we need to build have to be global. One thing that COVID actually taught us was that healthcare cannot be for a single person or a single ecosystem. If you are healthy in your home, but someone who is coming to help you or work with you in your home is not going to be healthy, or healthcare is not affordable for them, then it is going to put you at risk as well. So be it a selfish motive or a selfless motive, healthcare is an all or none game. If all of us are not going to thrive to be healthy, all of us are going to suffer the burnt of it. So I think that is the approach and that is the outcome that we are going
So the last question for the panel, and I'll start with Kumar. For the investors in the group and for the startups, the healthcare startups in the group, what is one bet besides AI? So, we have already talked about, what's the one big bet in the next 5 years? And I think if you could talk about Neuralink and brain-computer interface.
Sure. Well, I don't know if most people know about Neuralink. So that is Elon Musk's company, which is focusing on an implantable chip in the brain. He's probably the 9th or 10th company which is doing that. There are several ahead of him in that race. We've seen some of the development happen there. In our lifetimes, all of our lifetimes, we'll have an opportunity, maybe in 5 or 10 years maximum, where you'll be having a dinner table conversation saying, "Arey yaar, usne bhi chip lagwaya hai. Should we also get it done?" Now imagine if you have a chip in your brain which is connected to a computer and the computer is connected to the internet. In theory, you will have access to every book on the planet, every video on the planet, every phone number, everything. You don't need a phone. You don't need a laptop. You can close your eyes and watch a movie. You can close your eyes and think about calling somebody and that computer will dial that person. You can murmur to yourself and you'll be having a conversation to that person. It's a different matter that your spouse will think there's something wrong going on. But this is a future which is absolutely plausible. Technology is moving in that direction. We work on the non-invasive side, but I think invasive implantable devices, whether it is brain-computer interface, whether it is artificial organs, organs on a chip, artificial blood, all of these are technologies which are no longer science fiction. They are all sitting in labs in different parts of the world, waiting for approval, waiting for final clinical approval. And I think if you are an entrepreneur who's building for a 5 or 10-year future, then these are some of the absolute moonshot technologies which I think India will also really benefit from. And just before you start thinking, ki yaar ye kya bakwas kar raha hai, why put a chip in the brain? How long ago do you think was when we first got a pacemaker inside the heart? How long ago? It was 80 years ago that we first started saying, let's put a pacemaker in the heart. 80 years ago, when there was no internet, no mobile phone, no laptop computer, when we were nowhere as technology savvy as we are today. So when we accepted a machine inside our heart 80 years ago, why will we not accept a chip in our brain? Sorry.
Thank you. Interesting answer. Dr. Surpur, short answer on opportunities for the young and the investors.
Human being or human well-being at the core of any technology. So whether it is a startup, let me try to include more verticals into this. Whom does AI help? As long as we are talking about AI as a business model, as long as a tool in the hands of the startups, I think it becomes a very truncated or a very limited discussion. When we talk about AI as something that betters a parent, a mother, something that betters a population, something that betters startups, the only caveat being fear should not be at the core of AI intervention, because medical technology and medical interventions today thrives on the fundamental aspect of creating fear in the minds of the population. But instead of that, if well-being, human well-being eventually becomes the currency, then I think everybody is not only going to adopt AI, or for that matter, any technology that comes along with that. Business opportunities will be one simple side effect, which I think none of us can even bear. The benefits and the profits that the startups can tap into if they invest in this technology is going to be immense. But again, I repeat, it is a win-win situation that is going to help take AI along with everyone. Thank you.
So Dr. Khan, we have talked about AI, and but beyond that, healthcare has a lot of things. So you have wearables, you have synthetic biology, you have 3D printing, organ printing, lots of things are coming in, wearable devices. What is one big bet that you think the startups can take, which is definitely going to impact millions?
I think quantum computing is very interesting. That's increasingly exciting as well with the number of gains that are being made in quantum computing. Just this year, there have been papers that were published in Nature Biotech and other leading journals describing application of quantum computers for drug discovery. And I think in the next decade, 2 decades, that's going to be an important area to keep an eye on. Drug discovery powered by quantum computers.
Dr. Sabine.
I'll just go a little wider than one big bet. I think there are going to be a couple of things that are very fascinating in the next 5 odd years. One of the things is sensor-based diagnostics and developing more and more accurate sensors indigenously. That's going to be a key space where healthcare investments are going to shine, I believe. That also gives us an approach toward scale. Second is curative systems in biohacking, so which is largely a longevity approach, which I am hoping eventually will come and will have a scale option to it. So not just biohacking from a perspective of longevity, which is focused on a small set, but more population scale. And the third, where I see a lot of outcome happening, is creating, as I was saying, integrated systems. Healthcare and finance coming together to build wellness-based currency ecosystems, and also making sure that the data banks that we are creating actually have effects on personal care. So that will look at insurance as a solution, that will look at cumulative care as a solution, integrated care as a solution. So I think these 3 will be the segments in the next 5 years that I believe are going to shine. And I believe AI applications across all these 3 are going to fundamentally shift the way we are approaching them.
Thank you. Dr. VeluMani, so you have said, you are talking about 2 pregnancies, and anything that you are coming up with, I would not want the investors to bet and the startups to start doing that, because I don't think anybody in India or across the world can compete with your ideas. But beyond those 2 ideas that you have, what would be the opportunities for the startups and for the investors in the healthcare?
Always everybody thinks मेरा ये मछली वो पकड़ता है, अरब सागर है, इन्फिनिट मछलियां हैं, अपना अपना नेट डालो बहुत सारा मिल जाता है. That's number 1. India is a 1.5 billion population. An entrepreneur can feed 1,000 intestines. That means India needs 1.5 million entrepreneurs. Mind you, there are 1,000 verticals where these million guys can do business. So my advice to youth is not based upon AI, वो आने वाला है. जो भी हम समझ गया उसका बारे में मैं एडवाइस दूंगा. First, learn to focus. The one who focuses becomes the most powerful. What do you do is not as important as how do you do it. So many people think something else is only better. No, take something, do it the best, number 1. Number 2, वो मत करो जो पड़ोसी कर रहा है, वो मत करो जो पड़ोसी कर रहा है, क्योंकि फिर अब वही होगा जो पड़ोसी हुआ है. So if you don't differentiate, you are going to be one more padosi only. So learn to differentiate. It needs courage. There are only 2 kinds of people. One who has taken a decision, one who is successful, other could not take that decision. So take decisions, take risks. I don't think there is there are 2 different words. One is security, another is prosperity. There is never a secured prosperity. So take that risk, number 1. What goes wrong with entrepreneurs are primarily 4 things. The first one is the product. Don't think what you create is what the market needs. You must find out what market needs, you produce it. Then only you are successful. Otherwise, customer acquisition cost will be more than the turnover. Is that clear? There are two kinds of products. One is pull product, another is push product. Pull product means society needed it. You created it. People chase you. You don't need a marketing department. Push product, market didn't expect that, market doesn't want it, and you are trying to push it. So find out whether your product is full product or push product. So what goes wrong? Number one is product. Second is pricing. 90% of the businessmen have failed, entrepreneurs have failed only because they have overpriced it. Underpriced it. If still nobody buys it, it is not a product. And if people have bought it, that price also you will become very powerful. So what goes wrong? Product, pricing. Third one is packaging. Very often people have a good product, very poor packaging. The fourth one is presentation, storytelling, making market to be aware of how great is your product. So these are all basic fundamental inputs, but for the Gen Z, my advice is 4 words. First, have patience. Today's generation, and in the second year degree itself, I have an earth-shaking product. उसको दुनिया क्या है अभी तक नहीं पता. So first have patience. The punchline is don't try to become a billionaire before you meet your father-in-law. But you must become one before you meet your son-in-law. So first is have patience. Second is have focus. Don't chase 4 rabbits together. You can never catch any rabbit. One at a time. You can catch all the 4 rabbits. This is not then. Many entrepreneurs are doing 5 jobs together. Why that business? Again, second business. Sir, plan B chahiye na. If plan B is there, plan A will fail. So don't keep a plan B. You will be successful. Patience, focus. Next is frugality. Many people come to ask funds from me, and they come in a car which is costlier than my car. I don't give. So frugality, frugality is nothing but don't spend tomorrow's money today, you spend yesterday's money today. Patience, focus, frugality. The fourth one is discipline. Success is never a problem. Sustaining the success is the biggest problem. छोटा सा ऑर्डर आ गया, ऑर्डर अभी तक आया पहुंचा नहीं है, उसका बिल कभी आएगा, पेमेंट कभी आएगा पता नहीं है, आज ही मर्सिडीज बुक कर डाला. Discipline. Success is never a problem. Sustaining the success is the biggest problem. Whichever talk I go, last 4 or 5 minutes I take to tell exactly this, because this is not something everybody tells. This is not in textbook. I tell very clearly. I want to remind again the 4 in the same order: discipline, focus, frugality. Patience, focus, frugality, and discipline. These are the 4 things. Wish you all a great year 2026.
Thank you, sir, for these pearls of wisdom for the startups, and I would also say for the investors, because all this applies to what the investors are investing into. So thank you. With that, I had a great panel, and I hope all of you enjoyed it. Thank you, sir. Thank you, everyone.
Thank you so much, sir. Indeed, a very interesting panel. I'll request the moderator to please stay back and felicitate all our speakers. Thank you so much to all our speakers for giving their time, for giving their knowledge, and for adding such important value systems that I'm sure that we all one takeaway, and we'll always remember how it impacted on a longer run. I believe that, when we listen to these sessions, even if there is one takeaway that remains in our mind and we start implementing it in our real life, it doesn't give us 10x or 20x returns, but it gives us multifold returns of changing the character, changing the way we look at life, and changing the perspective towards things. So a big thanks to all our speakers for sharing the entire thing so wonderfully. And absolutely, I think the moderator also deserves equally the entire thing. Thank you, sir, for moderating the entire session so wonderfully and bringing out the exact question that I think remains in the mind of everyone. Now is the time that we move on to the next segment, and this segment talks about overview of India AI, overview of India AI tool, and India's vision of AI Impact Summit. For this, I'd like to invite our speakers on the stage. I'd like to invite Srimati Kavita Bhatia, COO, India AI Mission, to please join us here on stage.